Welcome my incoming sterile processor. I am back with another practice question. Let's jump right into this practice question. This practice question is important because you see similar question like that on your examination. The question says the process by which instruments are sterilized for urgent use is called, we have option A, rapid reprocessing, option B, core sterilization, option C, emergency sterilization, and option D, immediate use steam sterilization. So the first thing we have to do, we have to understand our question. We have to know what the question is asking for. So the process by which instruments are sterilized for urgent use is called. So they want to know the process for which the instrument will be sterilized because it's an urgent situation. So how do we sterilize instrument in an urgent situation? So that's why they want to know. And our right answer here is D, immediate use steam sterilization. The reason is D because the immediate use steam sterilization process is what we use for turnover. So what is turnover? So turnover is an instrument or a tray that needed to be used for 2 to 3 different surgeries at certain time. So for example, let's say room 1, we have a patient in room 1. She using a specific instrument. Let's say the instrument name, instrument B. She have instrument B in her room, but at the same like 30 minutes later or 1 hour later, room 2 also name that instrument B. So what we're going to do after room 1 is done with the instrument, we're going to send it down quickly. So we are not going to wait for all the instrument to be done or the whole surgery to be done. No. If the surgeon is done with instrument B and no longer needed for patient for the room 1, for the patient that in room 1, they're going to call with the sterile processor to send it down in decam, and then in decontamination they will process the instrument, clean it, pull it into the sonic, follow all the steps that we do to prepare our instrument. And after decontamination is done, they're going to take that instrument, send it to the clean area, the assembly area. The person that on the assembly table will examine the instrument. Okay, the instrument is clean, it's qualified to go for the immediate use steam sterilization process. So the immediate use steam sterilization usually it runs for 20 to 25 minutes. So this is the shortest time. So it's the fastest or sterilization process. Our regular sterilization process run for, I think, an hour. Run for an hour. Yeah, it run for an hour. So 20 to 25 minutes is half an hour. So that's why we call it immediate use steam sterilization. So let's see why the other answer choices are wrong. A said rapid reprocessing. So A is wrong because A is telling us we do this, the urgent situation happen every single day. Like that's what we do every day. No, we only have it once in a while. It only happen because we have 3 to 4 patients on their cases. They need that specific instrument. Probably will only have like 1 or 2 of that instruments. So we have to know the time space in between that. And also it can be caused by maybe the instrument tray is dirty. They find like a dirty tray and then they need that tray so we can still turn it over. And B said the core sterilization. B is wrong because this is not what we do. This is not like essential. It's not the process of us sterilizing instrument every day. No, we do not use the core process. We don't do it every day. It just happen in a situation or emergency where we have no choice. So the core is telling us that okay, this is what we do. This is how we process instruments every day. No, we do not. It's not every day we have like urgent use. It's just once in a while. Then we have C. C is wrong. C said emergency sterilization process. I know if you see C, you want to pick C, but C is wrong because in our department we have nothing that is called emergency sterilization process. We have nothing about emergency. We only have immediate use steam sterilization process. So that's why I made C wrong. Thank you for watching. Remember, practice make consistency, and consistency make a habit, and a habit give you the result that you deserve. Remember, if you need more practice questions, I have exam style questions in my bio that will prepare you for your examination. I believe in you, and you should believe in yourself. Bye bye. Love you guys.